Hey, this is Dr. Rob here, Committee to Protect Medicare Executive Director here in West Michigan, with another installment of our medical response to, and a little bit of other things besides medicine, response to the daily coronavirus briefing from President Trump and the task force. Again, joined by a member of our team at the Committee to Protect Medicare. I'm here with Dr. Ean Bett. He's a family physician in Columbus, Ohio, and also one of the founding board members of the Committee to Protect Medicare. So I'll send it over to Dr. Bett. You can maybe introduce yourself a second and we can get right into it.
Sure. Hi, everyone. As Rob said, I'm Ean Bett. I'm a family medicine physician here in Columbus, Ohio. I do some outpatient medicine with my own patients, started doing some telemedicine now that we're dealing with COVID. And I've actually been in the hospital taking care of patients as well. Did that a couple weeks ago, and I'll be going back in with our residents just about a week from now to take care of patients who are in the hospital, actually.
All right. Well, thanks for joining me. And I guess we can just get right into it. A lot actually was unveiled today, but want to get into some things that President Trump said and kind of dissect them a bit. One that we always hear about the peak and flattening the curve and the peak and the plateau and all that. And President Trump very clearly said, we have passed the peak of the coronavirus. So what do you think in Columbus, Ohio? And I can tell you what I think here in West Michigan about that.
Yeah, it's a pretty interesting statement to digest. Like I said, I'm doing outpatient medicine, inpatient medicine. And here in Ohio, I think we're pretty proactive in terms of using social distancing, closing some things down. And based on everything we're hearing on a daily basis, we haven't reached our peak. We are still planning that there are going to be more people who are contracting coronavirus. There are more people who will be coming to our hospital facilities. I just saw information and photographs on a central location here in Columbus for when we reach that surge. So we're certainly here on the ground, in the hospital, in the community, preparing that we're still going to see more cases. So I have a high suspicion that will happen here, that we've reached that peak is pretty disingenuous to everyone's work that's being done here to prepare to sick people.
Yeah, and I tell you, I know in Southeast Michigan, it's been widely reported in the Detroit area and the Tri-County area there that they are an absolute hotspot and have seen the numbers of new cases, kind of the numbers per day getting a little bit lower, which is good. I guess either a peak or a plateau has been reached there. But on the west side of the state, just a couple hours away, it's a completely different picture. We definitely haven't hit our peak. We are seeing our cases start to go up. We have no idea what that eventual curve will look like and where the peak will be. However, just like you said in Ohio, I know your governor has been pretty aggressive on the shelter in place and the physical distancing. Here in Michigan has as well, Governor Whitmer. We're very hopeful that that very aggressive work on her part and throughout the state will keep our peak low enough so we don't get overwhelmed. So yeah, I'm concerned when people across the country here, we've reached the peak, like as if, well, we've seen the worst and now we're coming down the other side, happy days are here again, that it isn't preparing them for tough measures that the governors are going to be calling for in different areas. And I think we're seeing, I know in Ohio and Michigan, signs of restlessness in the population about that. Now, so maybe just to get to that and for just one quick sec, I know it's been reported here what happened in Michigan yesterday. What's been going on in Ohio as far as, do you feel like most Ohioans or all Ohioans are sort of content with DeWine's actions, or what's happening?
Yeah, that's a really interesting question, Rob, because they're doing, an event on a daily basis to update the citizens of Columbus and Ohio in general to let them know how we're doing. And I think that's been very, very, very successful. When I talk to patients, when I talk to staff, when I think about it myself, it's been very convincing. And I think that's one of the reasons why we've done okay so far. That being said, we are still seeing an uptick in the positive number of cases, like you said, there in Michigan. And similar to what happened in Michigan yesterday, happened twice here in Columbus, and the State House is not far from where I work. It's very, very close walking distance. I've been there many times on lunch breaks and things like that. And people were out protesting the stay-at-home order on the steps of the State House. And I think it's really emblematic of, restless. But I don't know that they're getting restless with what we're telling them about the disease, the coronavirus, and the COVID infection. It's really they're getting restless at not being able to things that they'd like to do on a daily basis. And a lot of that has to do with the way that they're being treated economically. And that is another issue that I think you have to approach, not just the physical illness.
Right. I know here in Michigan, huge protest called Operation Gridlock, where they did bind up the streets around the Capitol in Lansing for hours. I know Sparrow Hospital, Level 1 Trauma Center in Lansing had its emergency entrance blocked. They couldn't get patients in and out by ambulance for a period of time. I think there's some photos of a doctor standing out in the street asking people to move so they could get patients in and out. But, they're directing their ire at Governor Whitmer. Yesterday there were hundreds of people on the steps in Lansing with flags, Trump flags, and otherwise Confederate flags, American flags, holding their guns, and that's certainly within all of that within their constitutional right. But they're out there without masks. They're out there high-fiving in the setting of a pandemic, trying to keep people separated. I'm highly concerned about that kind of generating a hotspot. And the reality is most of those people traveled from a distance within the state to get there. So all those folks can go back to their communities and, they may just in fact be delaying our ability to open up by that much longer by these actions.
Definitely.
And, so one frustration of mine has been now for probably a month or so was the lack of testing. And I know that's been a real problem everywhere. President Trump today claimed decreased numbers of testing. Been reported there are decreased numbers of testing at commercial labs, and they're saying we have the capacity. Why can't we do it? He's telling us that's a good thing. That's telling us there just aren't the cases, so we don't have to test them. I guess, what has your experience been with testing and where you're at now? And I can share mine after for a sec.
Yeah, and that's at face value, it sounds very reassuring. But for those of us that are taking care of people on a daily basis, and then when we superimpose the fact of how dangerous this virus is and how lethal it is as a disease, just saying that there's less tests in a commercial lab and, patting ourselves on the back does not tell the actual story. So certainly the number of tests available has increased over the last few weeks. That doesn't mean that those were great tests in the first place. Certainly the locations, for example, here in Columbus, where people can go and get tested if they have symptoms, has increased. But the number of tests available, based on my experience, has not gone up that much. My experience in wanting to test people is that I have to go through one channel that says, hey, we're going to decide if the person gets tested, not necessarily me as the physician who's taking care of them. I don't have tests on hand in my office or where I work to test people, even though the tests have improved in terms of doing that. I mean, I do have the ability to physically test someone if I had the tests. And then the amount of time it takes to get the test back has not necessarily improved. I have seen outpatient people. I had a nice woman that I recommended to get tested yesterday. She did go to the location to get tested. When I left work today, that result had not come back yet. So the promise that there is more tests or that we're doing less tests and putting a very positive spin on that does not tell the actual truth of how this impacts our medical decision making or how it impacts that person, because this individual was a health worker with elderly parents living with her. That knowing whether or not she's positive or not is the difference between her being able to help people physically at her job or not making money, having to stay away from her family members. it's not telling the full story.
Right, right. And when you said something about quality of tests, and that's still a concern of mine. I know we're being told that the sensitivity, that means the likelihood of, if someone has a disease, that the test actually picks it up, is somewhere around 70%. Maybe that's a product of collection of the sample, but for a single nasal swab, we're being told about that. And we've admitted multiple patients who've had 2 negative tests, and then on the third, they get a positive.
Yeah.
So these people have the disease all along, and we don't know. Again, that's the reason it's a novel virus. It's new. We don't know along the way how the virus sheds, how we're able to pick it up in some people at certain times and others not. So I'm concerned about that, and I'm concerned now, almost 3 months after the first case in the U.S. I don't think we have a significant amount of clarity on that. And then the other piece is just the number of tests that are being done. President Trump claimed in hotspots we're testing more per capita than even South Korea, still less than Germany, but more than South Korea. That may be true in New York, for instance. I think they are testing more per day per person than South Korea. But nationwide, we're still lagging, I think, 7 or 8 other countries as far as our number of tests per individual. And so it's very concerning to me, all the talk about opening up, when we still, to my knowledge, don't have enough tests. And the questions I've not heard asked in the briefing room are, how many tests are we doing per day? How many tests do we need to be doing per day? And what is the plan to get there? I still don't see that anywhere. I will be honest, I did look at the pathway that Dr. Birx laid out. And if people watching this can go back and just watch her part of it, a little technical, and so that to me is a little concerning that her side is technical, but I think very appropriate and seems like a reasonable pathway to getting things open again. But then in the same press conference, President Trump gets up there and offers a completely different, very, very kind of rosy, sort of science ignorant view of how we're going to do this. She's talking about certain gateway procedures to get you to starting to reopen, 14 days of decreased symptoms out there through their symptom monitoring system, and then 14 days of decreased cases coming into the ER that are, COVID-like or respiratory virus type symptoms. All of this then being in conjunction with the ability to test anybody everywhere and anywhere, which still isn't there.
Right.
And once you get past these 2 gateways of 14 days, that's like a month, right? It's a month before you can then start relaxing some of these stay at home and shelter in place orders. I worry because the president in the next breath says there are places going to be opening very quickly. And people just watching his talking points, he also said that people in Michigan at the rallies seemed to really like him, and they liked what they were hearing from the governor. Well, that makes me nervous if she's using science and he's just using platitudes saying it's going to happen fast. I still don't think that helps us. People are still going to be frustrated and not be following these orders from the governor or from your governor or governors elsewhere.
Yeah.
I guess, what do you think about those mixed signals we're getting?
Yeah, I would want to talk about with testing. Because of the sensitivity of these tests, we've made a decision in the hospital that even if someone with a rapid test is negative in the emergency department, it's okay to still test them again. So we've had to add a second layer because we don't know how accurate these tests are, and because we know how deadly this disease is. And it's affecting not just the people who are coming to the hospital to seek medical care, but also medical care clinicians and staff. This is a really, really serious issue, which leads into this mixed message. Again, putting a good face on the argument, giving some good sound bites is reassuring in the time when people are very scared about what's going on, both with COVID, financial well-being, and that is a very, very dangerous place to be, I think, for many Americans, to get mixed messages from non-medical professionals about what their risks are, interacting with other individuals, going out, like you said, and without masks, without taking any precautions whatsoever. it's a very dire situation and could certainly lead to more cases rather than less, which is what they think that they're going to be helping to start.
Right. And he, in the press conference said we're now doing, the capability to do 1 million tests a week. But I've heard reports from public health experts that we should be doing 1 million tests
Right?
a day. And
Yeah.
so, I mean, to my knowledge, we're seven times below where we need to be in that respect.
Yeah.
And he actually said there are some states based on, kind of looking back 28 days that are ready to open up tomorrow. And they would be announcing those. My concern is if they haven't been testing enough, how on earth can we know that? It's one thing putting up these very, very, very well done pathways. It's another thing, people implementing them correctly and sticking to them. And if we just start opening up without the tests, I just have significant concerns that places that don't have governors like yours and mine
Yep.
that are paying attention to the science. I mean, the governor of Georgia just last week said he only just realized that they're asymptomatic carriers of the virus. People have been talking about that for a
Yeah.
month. DeSantis, the governor of Florida, actually was promoting hand sanitizer he bought on Amazon that the CDC doesn't kill the coronavirus.
Right.
These are the people our sisters and brothers in Georgia and Florida are depending on because President Trump has said this is a state issue. The states will decide with some guidance from the federal government. That worries me as a national crisis that some states are going on. I guess the other concern for me is he said again today that he actually said, what do you want the federal government corners doing tests? And maybe the implementation of testing might be state and county based, but getting them the tests is something that the Defense Production Act is primed for, getting materials to them.
Yeah.
And getting the supply chain in line.
It's a very odd and mixed message that he is giving people, trying to act as if we're one country dealing with this, but then saying, I'm not going to give people the resources to let them do the things they need to do, make them make a decision.
Right.
And that is not, it's not the position that we should be taking in order to get past this.
And I know this is a medical response, but I said there may be some non-medical things, and I guess just for me, and you don't have to weigh in if you don't want to, but
Sure.
Another frustration is that Trump has such an inordinate amount of time talking at these. Again, the data, the items that Dr. Birx presented, and the questions that Dr. Fauci answered were actually helpful. We can dissect away right now why, over the ensuing weeks, why on earth it's been almost 3 months since our first case, and we now have this clear pathway of how to deal with it. South Korea had this one figured out 2 weeks after, and we're doing 10,000 tests a day in a much smaller country within a week of the first case. That to me is emblematic of the failure of the administration and has put us in this healthcare and economic crisis. Yeah. But the other piece is just his apparent need to be in front of the camera and then giving these mixed messages and in some cases false hope about drugs, therapies, things like that. Do you think he'd be better off if he was not part of these press conferences?
Most certainly, Rob. I think his desire to lead out in front, the way that he presents himself, and the amount of time that he takes to talk about things that really should be focused. Do we keep individuals safe, communities safe? How do we keep the medical clinicians and other professionals safe? Those are the things he should be leading with, and instead it's the exact opposite.
Yeah, absolutely. Well, I think we could go down this path probably for hours. I'm sure people out there don't need to hear us talking about this. They can hear other talking heads talking about it. But I appreciate you joining me. I appreciate the work you're doing in Columbus and the work you're doing with the Committee to Protect Medicare. I know that you and I talk offline in our overarching goal of getting affordable health care for everyone in this country. within and outside of this pandemic, this crisis, and all the people we're seeing now who need insurance. I think it just puts that much more in focus, even today, than it was when we started this organization, a few years back. Health care, and I think you have shown yourself to obviously be someone who's a warrior in that respect. So I
Thank
appreciate the
you.
work you're doing, and keep at it.
All right.